Welcome back. You're watching eNCA. We are discussing the new Omicron variant and the surge in the fourth wave of COVID-19 here in South Africa and especially in Gauteng. We are discussing this with Professor Shabir Madhi and Professor Sanne from Wits University, as well as Professor Bruce Mellado from the Gauteng Premier's Advisory Committee on COVID-19. Welcome back, gentlemen. I'm going to dive right back into some possible scenarios for the world going forward. And Professor Mellado, if I can issue this question to you. Looking ahead, do we learn to live with this virus while more people continue to die from COVID-19 like they do from influenza every year, except that we get gradually more and more used to those figures? I think Professor Madhi has already said, or Professor Sanne, that we're never going to eradicate the virus. So one of the other scenarios is possibly that each year a new boosted vaccine will become available, and that's something we need to get every year. Or give us some of the possibilities that we're looking at in the next 5 to 10 years, specifically related to COVID-19.
Okay, so the mandate of the committee is really to assist policymakers to understand what the data means as it comes, to really address very short-term questions as to issues pertaining to public policy, public health policy. In particular, one of the key ingredients to all the calculations and the numbers we crunch revolve around this gap analysis. Do we have enough beds? So this is something that is mostly short-term. Because the virus is so dynamic, we obviously know from experts that there is a long-term vision as to what we think is going to happen. At some point, we're going to go from the epidemic phase to the endemic phase. That will happen at some point. But since our mandate is really focused on what to do immediately, what to do the next weeks, this is something that we don't really discuss at length because we are absolutely overwhelmed with answering questions of today and questions of short-term policy.
Well, given those set of circumstances and the need for urgent reaction, what do you think, Professor Mellado, is one of or two of the key actions we should be taking now? We know that our government has reacted very quickly. We've taken a lot of very proactive steps in the past, reacting to changes in time, sometimes not always perfectly in time, but we do the best we can. Is there anything we haven't done yet that we should be doing with an immediate sense of urgency?
So as a committee, we issue a number of advisories. When we convene the meetings, we gather all the information and all the opinions from the different kinds of experts that the committee is composed of, all the way from clinicians to data scientists. So our message has always been very clear. Non-pharmaceutical interventions have to continue, and also vaccination has to ramp up. Our committee has always been very vocal about super spread events and the fact that we need to be controlling better, more efficiently gatherings indoors, in particular indoors, because we know from the simulations that the transmission happens much more efficaciously indoors than outdoors because of the nature of the transmission. And we are concerned that with level 1 that we are right now, that aspect is not as well controlled as it's supposed to be. Again, what we do is we advise, we put out our opinions to policymakers, and then policymakers balance this with many other factors. But yes, our worry currently is the issue of super spread events. Now, the other concern we have as we speak is because the recalibrated model seems to indicate that the peak of this resurgence will happen within the next 2 weeks. That coincides with the period
need to be evaluated by those provincial teams to indeed prepare for where we see the number of cases rising. At each hospital, we need to reactivate the bed planning in such a way that we can indeed drive the resurgence of bed capacity as and when required. My sense is that the movement of people around the country the virus has already spread and the pockets of infection are occurring already. So within the National Ministers Advisory Committee, of which I'm a member, the discussion at this time is not about further movement restrictions, but rather to, in fact, prepare the health system correctly to indeed be able to cope with the additional patient numbers. In terms of the long-term scenarios, I think the discussions are underway, particularly for the vaccines that we use in South Africa, to in fact adjust those vaccines according to variants. The boosting of doses for people who have been vaccinated up until now internationally has gone to a schedule of every 6 months. We do anticipate that, or I personally anticipate that we will have those discussions in South Africa. They're actually taking place at present, but we will have announcements as to additional doses of vaccination required. The J&J vaccine that we use indeed was a single dose, but I think the evidence is very clear that a single dose of vaccine is not as good as 2 doses. So the additional dose of J&J vaccine is likely to also become available within a very short period. It's not mine to announce, it's for the Department of Health to announce. But I would say to you within a very short period, with probably looking at the basis of that decision being the Ensemble 2 study, which provided for a 2-month interval for that vaccine. We therefore will go into recurrent cycles of vaccination, probably adjusted for variants around the world, and we will indeed then essentially keep the platforms open to ensure that we can respond to variants. We hope that the current Omicron variant is not too distant a relative from probably the beta variant, and that people who have been exposed previously and have vaccinated will end up having a mild course of disease. But again, we are really, really, really worried about the unvaccinated. South Africa has a capacity for over 350,000 vaccinations to be performed per day, yet we're running at a rate of around 150 to 178,000 a day. So we can easily double the number of vaccinations. And so I think the biggest message we've heard about the social distancing and NPIs and no gatherings, but my sense is that we need to move much more strongly into vaccination and indeed mandatory vaccination policies for people who wish to attend gatherings. And I think there is policies for Right to Care. My own organization has implemented a mandatory vaccination policy with significant success, reaching 94% of all healthcare workers and employees in the organization. We've seen sport, in fact, take on the Minister of Sport saying that spectators to events need to be vaccinated. And so, in fact, we've seen the university under the leadership of our Vice Chancellor, in fact, go to mandatory vaccination policies. And these need to be expanded more and more. To create the platform, engage everybody into vaccination. And then the real question you asked was, how does this look into the future? And I believe either the current vaccines will hold out for variants and we will see a dying down of this pandemic, or indeed we will see variant-adjusted vaccines in the future.
Professor Madhi, the discussion around the development of vaccines pretty much died down when vaccines were readily available across the world. There was still some media-driven conversations around, one vaccine type versus another. Those conversations have taken a backseat now. But obviously that work, this work done by scientists, is still ongoing in the background to see what kind of reaction there is to current vaccines and how to change those vaccines or adapt them to address new variants. Do you think a lot of those conversations should still be taking place in the public space to try and address ongoing vaccine hesitancy? Is the fact that we've stopped talking about the development of vaccines in the media, is that a problem?
Annika, I missed your question again.
Apologies, Professor Madhi. I think it's this delay. So the question essentially is, should we be having more public media-driven conversations about the ongoing development of vaccines to try and adapt to new variants?
So there's a number of efforts underway to try to develop a next generation of vaccine, which goes beyond just targeting this one component of the virus, which is a spike protein. And in fact, in South Africa, there are studies currently taking place, which looks at targeting both the spike protein as well as another component of the virus, the N protein, which has remained relatively unaffected by this mutation, very few mutations of that N protein. And the combination of this approach might well lend itself to developing vaccines that are much more resilient when it comes to additional variants arising, and particularly variants where the main mutations are occurring in the spike protein. So I think probably by the third quarter of next year, we will have a second generation of vaccine, which is very likely to be a bit more resilient, including protecting against infection and not just protecting against severe disease, which the current generation of vaccines perform extremely well against.
So what should we say to those unvaccinated who, based on your answer, might say, oh, well, in that case, I'm going to wait till next year for that second generation of vaccines? Is that, I see Professor Sanne is shaking his head, clearly not a smart plan, but tell us why.
So I think that that's a crazy plan, right? I think that get the shot that you can get in your arm today would be my message. I think that we can reduce the case rates enormously. It's not only about you yourself. If you feel bulletproof from this virus, and I certainly don't. I've worked in field hospitals in Quebec, I still can't say that word. I have worked in the wards in Johannesburg. You know, this is not a virus that you wish to try and be clever about. We have got very good, safe vaccines, and my sense is get that jab today. Do not wait for the clever virologists and vaccine developers to make a better one tomorrow. You can get that one tomorrow as well. It's not gonna stop you from getting that one. So get the one that we've got today as fast as possible.
I've got to ask one more question. It's about children under 5 being hospitalized in large numbers. Professor Madhi, if you could answer this one for us, can you tell us why that's happening and what likelihood there is of a vaccine being developed for under 5s in the near future?
Yeah, so this has really been unfortunate. I think I need to be clear, there has not been an increase in hospitalization of children with COVID-19 with Omicron variant. The thing that happens in most of the pediatric wards, including at Chris Hani Baragwanath's hospital, is every child that is admitted to the ward, he has a screening test done to see if they're infected with the virus or not, so that we know where to nurse the children. And the same thing goes for pregnant women that are delivering babies. They come into the hospital, and some facilities are actually testing all of them. Now, when there's a lot of virus circulating in the community, and this was our experience during the course of the first wave, between 15 to 20% of people in the community will be infected with virus if you sample them when the surge is taking place. And what is currently occurring in hospitals, including in children, is that 80% of the children that are testing positive are not being admitted for COVID-19. They're actually being admitted for other conditions, but because they're being tested to find out if they're infected with the virus, so we know where to nurse them, they're testing positive. So the narrative that there's been an increase in hospitalization of children for COVID, it's sort of incorrect in that COVID itself is not too much of a problem and still does not remain a major problem in children. But yes, children are testing positive, but that does not mean they've got COVID. And the same thing goes for pregnant women. When they're delivering a baby, 15-20% of them are testing positive for the virus. That does not mean that the woman actually have got COVID at that point in time. So we just need to be careful about the figures. Unfortunately, the figures that NICD actually provide doesn't distinguish between just being infected with the virus compared to us actually having COVID and that being the reason for hospitalization.
Well, thank you very much for that clarification. Thank you to all three of our guests. We have since lost Professor Sanne, but thank you for his contribution. Thank you also to Professor Shabir Madhi and Professor Bruce Mellado. The message very clear there. We need to look very urgently at the number of gatherings taking place and ultimately vaccinate, vaccinate, vaccinate.